Okay, so after you see the bladder, when you see the bladder, you're in a nice position to get the femur length. So I find you're also in a nice position to see the sex of the baby, so you could do that while you're here. This is a nice shot of the girl parts. But let's get back to biometry. Mom's always really wanting to know what they're having, so while you're here, you can always solve the mystery for them. But if you're coming here, you want to get the femur length. Once you get to the urinary bladder here, you want to turn 90 degrees because I can see part of the femur there. But when I see the femur in transverse, I know I need to go 90 degrees to lay it out. So when I see only a tip of it here, that means I'm hitting it at a transverse plane. So I need to go 90 degrees from whatever position I'm in. So if I'm here and I'm transverse almost on mom, I need to go 90 degrees like that to lay it out. So you stay in the same position, don't move, just turn your transducer 90 degrees. Whoop, the baby's. Now sometimes the baby doesn't like if you find it, so we'll go back and find it again. And all we need to do is slide subtly. It's going to happen, so you need to know how to move with the baby, follow the baby wherever she's going, and freeze it. Get your calc package, bony end to bony end, and acquire. So when we're here at femur length, this is also a nice place to sort of sweep through to look for sex. You can see clearly that this is a girl from the labia. You can also, while you're here, check the lower leg. We like to make sure that when we get to, well, we certainly want to make sure that there's 2 feet and 2 hands, but we also, when we're looking at the lower leg, we're not only looking at feet, we're looking at the ankles. We want to rule out a club foot. So when you see the lower leg here, you want to make sure that you're seeing the end of the foot dead on and not a foot in a sagittal plane, or it would indicate that there's a club foot. So while I'm here, I'm also noting that there's a 3-vessel cord. Another good way to find that 3-vessel cord is when you're at the bladder to put color on. And I think Dr. Philly went over this in his discussion, so I won't spend a lot of time on it. But you can see the cord splitting, the umbilical artery splitting the bladder there. And that covers biometry in a quick fashion. Again, we like to get 2 measurements, but if this is a very limited scan and you only want to do 1 because you want to get growth and an AFI, then you can do that.